Hello everybody and welcome to part 2 of this very special edition of the Human Physiology video tutorials with Dr. Jamie Macdonald and Dr. Sam Oliver. Now in this final part we're going to talk about emergency situations and practical tips out on the actual mountain. So first, Jamie, I'd like to ask you, so firstly, how can we prevent an emergency situation occurring? And if an emergency situation does occur on Kilimanjaro, how would the trekkers deal with that?
Okay, so by emergency situations, I presume what you're talking about is sort of more serious conditions of high altitude cerebral edema and pulmonary edema. But this advice also for prevention is also very relevant for acute mountain sickness as well. So generally what we recommend to do is watch the first part of the video. You'll see there's lots of tips in there about things like trying to prevent getting coughs and colds, because they can actually exacerbate your risk of getting one of these illnesses in the first place. Then once we actually get out onto the mountain, then we need to try to use an ascent profile, which is recommended, and slow ascent profiles we know decrease the risk of acute mountain sickness. So a typical rule of thumb that we use for people who've not been to altitude before is above 3,000 meters. You should sleep no more than a gain of 300 meters per day, and on every 3 days you should take a rest day. So typically that's a rule of thumb we use. Some people may be able to ascend quicker, some people will still get sick even with that ascent profile, but that's a good starting point for people. Other things that people can do is just make sure that they follow the rest of the tips in the video, making sure they're well hydrated but not overhydrated, they're well fed, they're nice and warm, not too hot, not too cold, etc. Because a lot of those symptoms are actually shared with acute mountain sickness, so we need to resolve those issues first.
So Jamie, what I want to ask you now then is, if a person was to experience somebody with acute mountain sickness, or indeed they were to have acute mountain sickness themselves, so i.e. they encounter an emergency situation on the mountain, what would they do in that scenario?
So let's just remember that acute mountain sickness itself, if it's true AMS and it's mild, even moderate, then it's a self-limiting condition, so it will resolve over time by itself. Typically you need to make sure that you've addressed every other potential cause of the symptoms, so make sure that your patient or yourself is not too cold, they've got adequate food and fluid on board, they're not overtired, etc. Once you've done that and the symptoms remain, providing that you don't ascend any higher and providing that you don't overexert yourself, then the symptoms will resolve. Now if the symptoms don't resolve or they become severe, or you begin to have those symptoms of the more serious altitude conditions like HACE or HAPE, so remember that's any sign of altered consciousness or any real difficulty in breathing, then in those situations, they are life-threatening situations. And in those situations, the best form of treatment is always descent. So you should try to descend off the mountain, even if it's late at night, unless there's some real risk for why you can't do so. Even if you can only move a few hundred meters down the mountain, you should try to do so. Try to get as low as possible. The other thing to do then in that situation, it does depend a little bit on your level of experience, but do ask around you for the other groups, especially on Mount Kilimanjaro. Lots of the groups will be equipped with equipment and drugs which can help to actually treat people on the mountain who've got these conditions. So there are some drugs available. You can ask to see if they've got some acetazolamide, which we talked about earlier, some dexamethasone, some nifedipine, and if people are carrying those drugs, they'll normally know the dosages that they need to give them to. They may have access to other equipment, like, for example, something called a Gamoff bag, which is, it looks like a sleeping bag, but we pump it up to try to simulate a reduced altitude. That some people may actually be carrying oxygen, and we can give oxygen as well. But all of these things are on top of or as well as trying to descend. So the first treatment is always descend.
Perfect, fantastic. Okay, so now moving on to some kind of practical tips. So Sam, I want to ask you, we've got an altitude chamber here. There's also commercially available masks, altitude masks that are available. Are these things useful, or what kind of things practically could one person do to help them prepare?
I think you've just raised there are some specific altitude training devices. So like you said, there's masks, there's breathing type products that are on the market to try to improve breathing strength. There's chambers such as this or generator type systems that are based on masks to create a hypoxic environment. I think all of them potentially may have some beneficial effects. Certainly psychologically, I think they probably make people feel they're more prepared. But the physiology and literature is equivocal, and the recommending any particular one of those methods, apart from doing many days in like an altitude chamber, which isn't really practical for most people, and therefore as a group of methods, altitude training methods, I'd say that practically they're not very useful. So instead, some of the other points that we made out in the first part about getting fitter, getting more experience of using your equipment, being in those mountainous type of environments, they're going to have, are more accessible to people and likely to lead to more beneficial effects on the trek than perhaps expensive and non-practical altitude methods. I think people like to have a silver bullet. They like a simple supplement, they like a drug, they like something that's easy to take, but it's the hard work and making the time to go out and use your equipment and gain confidence with it out in mountainous environments before you go, which is going to be more important for a trek on Kilimanjaro.
Perfect. That reminds me a little bit about Rocky 4. So you've got Rocky training in a barn using simple methods, and you've got Ivan Drago with the high-tech equipment. So it's always the simple methods that work best. Okay. So, another question that I've got here is there a particular breathing technique that a trekker should use when they're going up Kilimanjaro?
Breathing and continuing to breathe is very important, obviously. But what, in all seriousness, so people are aware, particularly those people who haven't been to altitude before, when we go into a hypoxic environment, one of the first physiological responses is to increase breathing, and that's very normal. So we increase breathing to help keep sufficient oxygen traveling around the body to where we need it. So people shouldn't be anxious when they feel their breathing being increased at altitude. So that's one thing to expect. Clearly, if you're breathing a lot, that actually has an effort. You start to engage more and more of your respiratory muscles. So we would suggest to try to just maintain normal breathing. Don't try and breathe more because that's increasing the work of your respiratory muscles, and actually will probably start to feel uncomfortable and feeling breathless. Again, that's what we have when we exercise hard, and again, that's generally one of those perceptions we have that actually might even make us want to stop exercising. So being aware that your breathing is going to rise, definitely not trying to over-breathe, and try to maintain as normal breathing as you can, particularly as you're exercising, because increased breathing is going to probably lead to fatigue during the day.
Perfect. Okay, thank you very much for that, Sam. So I suppose I want to kind of finish off on some kind of general practical tips, the kind of everyday things that one person must consider. Do you have any kind of insight about that?
I think whenever you're going away on an expedition, there's a lot of additional things to think about. Some things that I can think of, checking you've got the right insurance, so for yourself to be evacuated, but really best practice would be to ensure that it covers the porters and the guides and things, that if one of those became ill, that you could get them helicopter evacuated if that was a requirement. Ensuring that you visited your dentist fairly recently, because having tooth pain is severe and is something you don't want additionally on a trek where there's not going to be dentists nearby to help, or it's unlikely there to be. And ensuring that your immunizations, your vaccinations are up to date, and you've had the recommended immunizations before you travel. Again, you don't want to fall ill whilst you're there, or potentially when you return back to the UK. So some general health advice. Immunizations, you can go on to the government websites, Foreign Office, to find out details of those, or visit your GP. They will be able to help you with that.
Fantastic. Okay, so that's really, really, I mean, I really didn't even think about going to the dentist as a particular preparation tool. So that's really, really insightful. I mean, I think we've definitely learned a lot from having Jamie and Sam's expertise today. So I really want to finish off then. So in terms of anybody that's going up to Kilimanjaro, we know that it's a big challenge. You know, it's something that you would be doing perhaps once in your life. Do you have any kind of final motivational kind of advice to people that are going to be going up? I'll start with you, Jamie.
I'd just say practice everything that you want to do on the expedition beforehand, and it will be fun to do so. Practice wearing your rucksack, wearing your boots, practice using your water bottles, and you'll get excited about doing the trip because you'll see the tangible things that you're going to take away with you, learn about the area you're going to, just try and practice as much as you can beforehand. And also maybe just have a read of one of these as well. This is a little freely available guide on the web. It's called the MEDEX Handbook, Travel at High Altitude, and it's recommended really to try and put your mind at rest so you enjoy the trip as much as possible.
Brilliant. Thank you very much, Jamie. And Sam, any kind of last bits of wisdom from yourself?
I just think I'd echo Jamie's comments. I think that preparation and prevention certainly should be the focus rather than considering curing things through drugs, because I think it's in the preparation and doing your training, doing the other bits that we've talked about, which will ensure that you're in the best physical state, which will give you the confidence to really enjoy your trip. And good luck to all those that are going up to Kilimanjaro.
Brilliant. Thank you very much, Sam. It's been an absolute privilege and pleasure to have both Jamie and Sam here today. They've really been very insightful. I've learned a lot listening to the information that they've given. I hope you've learned things at home as well. If you do have any questions or any comments, please do feel free to leave them in the comments under this video, and I'm sure that Jamie and Sam would be happy to address any further questions. And I'll hope to see you again very soon on another video tutorial. Thank you very much.